Hello everyone, this is Cecilia.
Yeah, no, I'm good. So you're all
Today
set.
we're going to talk about migraine.
Gracias.
So migraine is basically a neurological condition. It is a headache that can cause intense throbbing or pulsing sensation in one area of the head and is commonly accompanied by nausea, vomiting, and extreme sensitivity to light and sound. There are two types of migraine: migraine without aura and migraine with the aura. Basically, the difference between diagnosis is that migraine with the aura, they have one of the following symptoms, such as visual symptoms like vision loss, flickering light spots, and sensory symptoms such as pain or needles or numbness, or speech disturbance such as difficulty putting words together. And some symptoms of migraine have moderate to severe migraine, and they have throbbing, pulsing pain, which usually confined to one side of the head during the attack. People will feeling sick or physically being sick during the attack, and they have increased sensitivity to light and sound relieved. They will be relieved by lying quietly in a darkened room. Approximately one-fifth of the migraine sufferers will experience aura, which is a visual disturbance such as wavy lines and dots and flashing lights, etc. for like 20 minutes or to 1 hour before the actual attack. And aura is due to the transient changes in the activity of specific nerve cells. So this is a graph basically shows you different stages of the symptoms. So for example, the prodrome, which is stage 1, people normally will suffer days before the actual attack, and suffer will experience like sound sensitivity, depression. And stage 2 is normally the aura, which is the light disturbance 20 minutes before the attack. And stage 3 is the actual attack, the headache, which restrained to one side of the head. And stage 4 is the postdrome, which people normally suffer from like fatigue and mood changes days after the attack. There are a lot of factors that will trigger migraine, first such as alternation of sleep cycle and missing meals, bright lights, stress, hormone irregularity, or the fundamental neurological abnormalities that are caused by genetic mutations.
Okay, so why do we get migraines if we don't have nociceptors in our brain? Well, basically, what's going on is that there are nociceptors in the dura and in the pia mater. So although your brain doesn't have nociceptors, this protective shield between the brain and the skull can still cause pain. So the pain of the migraine occurs when excited brain cells trigger the trigeminal nerve to release chemicals that irritate and cause swelling of the blood vessels on the surface of the brain near the dura and pia mater, which activate the nociceptors, and that's why we have migraines. So you can see the dura and pia mater here next to the brain. So here is just a diagram, and you can see the different, like how the migraine is activated. So you can, the nerve cells, the increased blood flow causes inflammation. You have chemicals releasing from the nerve cause inflammation, and this inflammation then causes the nociceptors and the meninges, or like the dura and pia mater, to cause pain. So treatment and drugs. So there are two types. You have pain-relieving meds and preventative medication. So basically, preventative medication or pain-relieving medication is supposed to stop symptoms. So triptan, it helps constrict blood vessels and blocks the pain pathways in the brain, and so it acts on serotonin receptors, and so it has an agonist effect on the serotonin receptors in the blood vessels, which cause their constriction, and also stops neuropeptide, or the inhibition of neuropeptides that cause inflammation. So you can see that right here. You have aerial rods, and they are less effective than triptans, but they do a similar idea where they constrict or narrow the blood vessels in the brain, and it's not exactly clear how they work. So these are anti-nausea meds, and opiate meds do similar things. And We also have preventative medications. So you have your cardiovascular drugs, which are beta blockers, and they reduce the frequency and severity of the migraine because they help relax the blood vessels, but they're not exactly sure how exactly it works. You also have antidepressants, and you don't have to be depressed to benefit from these. They reduce the frequency of the migraine by affecting the level of serotonin. And then anti-seizure drugs and Botox and pain relievers have also shown assistance in making migraines less frequent. And that's it. Thank you.